Welcome to Health Decoded. The title of today's discussion is The Virus Linked to Multiple Cancers.
Yeah, it's a pretty heavy topic, but an incredibly important one.
It really is. Today our goal is to help you, the listener, understand human papillomavirus, or, HPV, and its direct link to cancer. And, more importantly, how you can proactively protect your health.
Right, because there's actually a lot you can do.
Exactly. To kick things off, let's think about your immune system like a nightclub bouncer. Usually it just kicks uninvited viruses out before you even know they're there.
Yeah, the bouncers do a great job most of the time, but HPV operates a bit differently. It's incredibly common and spreads easily through sexual activity. The real danger isn't just encountering the virus, though.
Right.
The danger is when it manages to sneak past those bouncers and stick around in your body for a long time.
Wait, if the body usually clears it out on its own, when and why does it become so dangerous? Like, why doesn't the bouncer just toss it out eventually?
Well, it comes down to what we call high-risk strains, especially strains like type 16 and 18.
Okay, what do those do?
They're actually responsible for about 71% of cervical cancers globally, and they're masters of disguise. Instead of just floating in the bloodstream, they burrow deep into the skin or mucous membranes.
Oh, wow. So they literally hide.
Exactly. And once they're hidden, they integrate their own viral DNA right into your cell's DNA. They essentially hack the cell's programming.
That sounds terrifying.
It is, yeah. They turn off the safety switch that normally tells a damaged cell to die. So with that switch broken, the cell just, keeps mutating and dividing out of control.
So it's basically rewriting the cell's source code to slowly create a tumor. And I want to make sure we highlight this. It isn't just a women's issue, right?
Far from it. Yes, it's strongly linked to cervical, vaginal, and vulvar cancers. But high-risk HPV is also heavily linked to cancers of the penis, the anus, and even the throat, mouth, and head.
Wow, okay. So it really affects everyone.
It truly does.
So if someone listening to this is an adult and, already sexually active, is the ship already sailing on prevention? Have they missed their window?
No, absolutely not. It is true that most people catch some strain of HPV early on, but the Gardasil 9 vaccine gives your body a really safe way to build immune awareness.
Even if you already carry a strain of it?
Exactly. Even if you have one high-risk strain, the vaccine blocks the other ones from taking root. You're protected from the strains you haven't encountered yet.
Okay, so it's basically handing your immune system a wanted poster for the virus, ensuring your body neutralizes it before a new infection can even start.
That is a perfect way to describe it.
So when should people be getting this wanted poster?
Well, the routine recommendation is at age 11 or 12, and at that age, it only requires 2 doses.
And what if you're a bit older?
If you get it between ages 15 and 26, it takes 3 doses. But the great news is that it's FDA approved for adults up to age 45.
Oh, wait, really? Up to 45?
Yep. So if you're in that 27 to 45 bracket, just chat with your doctor about your lifestyle risks and see if it makes sense for you.
Okay, moving to the practical realities. How safe is it?
It's incredibly safe. You might get a sore arm or, some temporary dizziness right after, but just sitting down for 15 minutes completely prevents that.
That's super easy.
Yeah.
But hold on, if the vaccine is so effective, why do doctors still insist on regular, uncomfortable screenings? Like, why do women still need a pap test?
That's a crucial point. The vaccine is a shield, not a cure.
Meaning what, exactly?
It stops new infections,
Yeah.
but it does absolutely nothing to clear out an infection that might already be hiding in your DNA. A pap test doesn't look for the virus itself. It looks for the precancerous cellular changes caused by the virus over years.
Oh, I see.
So regular pap tests starting at age 21 are still an essential part of health screening. The vaccine prevents new fires, but the screening makes sure nothing is already smoldering.
That makes total sense. It really leaves you pondering a fascinating reality. Getting a simple vaccine today is essentially stepping into a time machine. You are actively intercepting and canceling out a potential cancer diagnosis decades in the future.
It's pretty amazing when you frame it like that.
It is.
Yeah.
What other small proactive investments could we be making today for our future health?
That is always a vital question to ask. And of course, please remember to always seek a doctor's advice regarding vaccinations and your personal health risks.
Stay informed, stay proactive, and take care of yourself. This is Health Decoded. Keep healthy, folks.